I'm gonna hide loading meeting controls. There we go.
All right. Hi, guys, and thank you for joining me this evening. Today, we'll be talking about modeling green space and health outcomes, integrating spatial and statistical analysis for green space planning. I'm going to just give a brief background on open green space, why it's important, then we move into planning and how people actually, what the most likely avenue is when people get green space, what goes on. My methods of what I did to do my analysis and spatial, my spatial analysis and statistics, and then key findings and discussion points. So let's go. Open green space. Well, an open green space are parks and open spaces that are publicly owned lands that provide outdoor recreational opportunities, whether active or passive, and are intended for public access, enjoyment, and environmental benefit. So some examples of open green space are all local, state, and federal parks, open play fields, as long as they're open to the public, plazas that focus on recreation. These are all examples of open green space. Something that needs to be considered is that even though you need like a parking pass to drive to park on these parks, it is free entrance without. So we do have already an issue with proximity, right? You need to, if a park is far away, you're going to probably have to drive there, and you will need, while it's free to use, it's not free to park. So that's something that I just want to keep in mind. Oh, that's right. Okay, so why green space matters? Well, a lot of scientific literature reveals many health benefits to green space, improves physical and mental health, associated with lower chronic disease risks, and supports well-being and sense of place. In particular, when I really dug into the lit review, it seemed like proximity and NDVI, and NDVI is vegetation health, essentially, how rigorous the vegetation is and how healthy, played strong factors in mitigating health and social outcomes. Green space, in particular proximity, so green space located within 500 meters, or roughly a 6-minute walk, provides particularly strong protective benefits on health, especially for things like obesity and cardiovascular disease. High quality green spaces that have high NDVI also strengthen social cohesion by providing spaces for leisure, recreation, and which in turn supports mutual trust and more civic engagement. So the Recreation and Conservation Office is Washington's primary state outdoor recreation and conservation grant funding agency. They've awarded more than $2 billion worth of grants so far in over 9,000 projects, not just limited to parks, but other conservation projects and recreation projects as well. There is more information here. If anybody, my web map, the story map is open to anybody. You can click on there to get more information on RCO. And how they determine some green space funding when like a local nonprofit or a city applies for it, they utilize a robust competitive grant application process that partially incorporates green space acres per thousand, which is a metric along with social vulnerability and poor health outcomes within a census tract as a scoring metric. And kind of how that breaks down is they use something called the Protected Areas Database. And as you can see here, all this green is all the reported open green space that was aggregated from DNR, federal lands, municipal parks by Green Info Network. And what they do is they, in each of these census tracts, which is roughly anywhere from 3,000 people to 5,000 people, they calculate how many acreages are in there, and then they divide it by the population to get that parks per thousand metric within that census tract. And then they aggregate it kind of back up, and then they rank it from low, medium, and high. So if you ranked high in green space, you'd probably get 1 point towards your grant score. If you had low green space, you'd have 3 points. The more points, the better chances are you're going to get funded. They also factor in 2 indexes. These are poor health outcomes and then the social vulnerability index. The poor health outcomes has measures like COPD, cardiovascular disease, mental health status, and low birth weight. And it's supplied by the Washington State Department of Health Center for Health Statistics. And the Social Vulnerability Index monitors things such as household type, minority status, transportation, socioeconomic variables. And each census has a score, basically. Rank 5 for this particular one in King County for PHO, but it has a social vulnerability rank of 1 for SVI. And so they vary across. And if you have high vulnerability, you're going to get another 3 points towards your grant score. You may have low vulnerability, so then you'll get only 1 point. And the same goes for PHO, 3 points for high, 1 point for low. So what I wanted to find out is, are there other Greenspace metrics that can capture different dimensions of health in order to better predict better health outcomes? So I wanted to take Greenspace acreage and compare it with these health metrics. And then I wanted to use 2 others and see, well, which one looks like it would predict better. So my first question is there an association between Greenspace metrics and health outcomes? And I used correlation for that. And research question 2 was, which Greenspace metrics predict better health outcomes when accounting for other community factors? And that's multiple linear regression. So these are the metrics that I used. I already had the parks per 1K, so I didn't have to do anything there, but I did have to create my proximity and NDVI. For the health variables, I use them to control each other. They're very strong indices and would count for controlling for socioeconomic status and things like that. I also parsed out cardiovascular disease, obesity, and mental health as those stood out most in the lit review as most beneficial. And I wanted to do a little bit more control testing on that to see what those results would be. So for my proximity, I had to download a 2020 US Census block population data and spatially join it with my existing Greenspace and census layers. And what I did was I drew a 500-meter buffer around each of those parks that you saw previously in that previous slide. And I assume that 500 meters is reasonable walking distance. Network Analyst would have been a lot more accurate, where you can actually tell it drive time where, and it will factor in certain barriers and things like that. But you need to know your park entrance for that to happen. And I did not have that information. And it would just put it right in the center of the park. And so that wasn't going to do me any good. So I just did a 500-meter buffer around. So over 140,000 census block polygons were intersected with these buffers to estimate the proportion of each block's population living within proximity to parks. And as you can see here, this is the normal population that's not in the buffer. This is, and then so part of this is not within this is not 100% proximity cover. The reds are the parks the buffers that I did draw around. And to do that, I had to, the proportion of the track's total area I had to multiply the proportion by the track's total population to yield an estimate count of people within that proximity of the buffer, and then sum those estimates back to the track and then calculate the percent of the population within that 500 meters of green space at the census level. And it looked like this in the end. So we have percent cover of each census tract. The white, I meant to change the white into a little bit more blue, but that's showing that that's 100% cover. So like around the I-5 upper area, there is quite a bit of 100% proximity coverage with park space. Dark colors show less, lighter colors show more. So next, so I had that then. Each of those tracks gave me a number that I could now use for a statistical analysis, which was a percent. Then I moved into the normal differential vegetation index, and that is a satellite-derived index that measures how green and healthy vegetation is. Values range from -1 to 1. And this was received from Sentinel-2, kind of like our last presentation. Yeah, I had to, it was mosaic, so I had to take, I believe, 13 tiles, merge them together, and then pull out certain bands, which are near infrared and red. And you do equations with those to get your -1 or +1. So for each pixel, I did NIR minus red divided by NIR plus red. And it would give me a number, and I turned that number into a color, which represents plant health and vigor. I then aggregated it back to the census tract. And I'm not too happy with how this looks. I tried to do the classic red and green NDVI, but this will do. So this one is showing that the wider the yellower the tracks, the less plant health there is. Where the darker, the more plant health. And this makes sense. We're talking about forest, Olympic forest. And okay, now that I had those, oh, and they cut it off. It cut off. All right, well, so now that I had my units, I wanted to do first correlation just to get a broad assessment of possible association with these green space metrics. And what I found is that park acreage, the one that is right now used for RCO, shows weak but generally consistent correlations, all usually trending towards the positive side. Proximity exhibited small but meaningful associations, especially with obesity and social vulnerability index, while NDVI showed the strongest relationship overall, but it had a very negative correlation with like social vulnerability, which I'll discuss why I think that is in a moment. I also included some correlation here just to get a brief look, like particulates and such. Then multiple linear regression, and I'm sorry, cut it off here too. So I did multiple linear regression on each of the three, so park acreage, proximity effect, and vegetation health. And what I found was that the only one that tested bad, negative, was NDVI, which showed that it actually, the greener your community is, the more increase of a PHO you have. In other words, you have more poor health incomes or poor health outcomes. I think that has something to do more with the urban locations of where these were located. Definitely, I don't think NDVI can compete with the diesel and the fog and stuff. So that really, that kind of was something that crossed my mind. Tripling park acreage produced a 0.01 decrease in PHO rank, and for every 1% increase in proximity, PHO decreased by 0.01. Nothing too, I mean, it's nice to see that they're doing their job. I would be nice if I could see something a little bit more stronger. Proximity, though, is decent in the strength. For the social vulnerability index, the SVI, so doubling park acreage per 1,000 is associated with a -2 point decrease in SVI rank, which is good. For every 1% increase in green space proximity, SVI increased by -0.01, which is bad. And for every 0.1 increase in NDVI, there was SVI rank decreased by 0.80 units, which is what I kind of expected for the PHO with NDVI. I expected it to have a positive effect on both. I also just did some quick ones on those other ones of cardiovascular disease. I really didn't see anything noticeable here. Nothing really predicted that when I factored in like smoking and CVD or smoking, race, income, those kind of really took the charge. Mental health, though, NDVI showed a strong negative association. Proximity to parks, modest improvement in mental health the closer you lived, and park acreage had a small beneficial relationship. So more parkland was linked with slightly lower poor mental health rates. And lastly, obesity, and really the only one that obesity measured well was proximity, which is what went well with the lit review. So let's talk about some of these key findings here. Park acreage showed weaker but generally beneficial associations with health outcomes overall, except for obesity. It also demonstrates a modest beneficial relationship towards lower social vulnerability. While proximity shows a strong and consistent beneficial association with health outcomes, including obesity, it is negatively associated with social vulnerability. And NDVI is associated with the worst health outcomes out of any model, including obesity and mental health, but had a strong beneficial relationship with social vulnerability. Some quick discussion points. Parks per acreage is 1K. Communities with more parkland per resident may experience broader social advantages, even if direct health impacts are somewhat modest. People are closer to parks. Many socially vulnerable communities do live near parks and in dense urban areas where parks may be lower quality. And that's why I think that it tested low for social vulnerability proximity, but much higher for poor health outcomes. And NDVI likely reflected rural and semi-rural landscapes rather than usable urban green space. And I would probably say if I were to do this again, I would rescale it and only look at park health and then aggregate it to the census tract for each area, and not just do the entire mean, assuming that parks were correlated with a higher NDVI at that census tract level. That's what I would do next. In conclusion, the strongest SVI predictors were NDVI and park acreage. Continuing focusing grant criteria on per capita acreage and investigating NDVI potential more could meaningfully reduce vulnerability. And proximity to green space was the only statistical significant green space metric predicting poor health outcomes. Improvement in access can improve health outcomes more so than acreage or NDVI alone. That's a lot. I felt like I was going fast because I felt like I was running out of time. But any questions?
Stop the recording.
Hello?
Just a second. Sorry, let me just stop the recording before we ask any questions.